Your tummy muscles become stretched during pregnancy. After your baby has arrived, there are some simple steps you can take to help them recover. Claire is a specialist women's health physiotherapist and has come to give new Mum Louise some tips and simple exercises you can do in your own home.
These exercises are good for you if you've had a vaginal or caesarean delivery. No matter how fit you are, they are fine for you to do. Just stop them if you get any discomfort and speak to a GP, midwife or women's health physiotherapist. So we're going to move on to the next exercise now, which I think will be good for you at this stage. Okay. So we're going to incorporate the first exercise we did when we talked about trying to pull in gently the tummy muscles, and then we're going to add in a movement. Okay.
Yeah.
So let's just get those tummy muscles working first. So take that nice relaxed deep breath in.
Yeah.
And then as you breathe out, pull that belly button in. That's it. Now keep those muscles gently working as you breathe. Don't hold your breath.
Yeah.
Okay. And I'm just going to place my hands on your pelvis and help you do the movement.
Okay.
Because what we want to do is try and tilt your pelvis back into the bed. That's it. And then just relax it back. Good. Excellent. Keep breathing. Keep those tummy muscles working as you go back and then back in. Great.
Okay.
Yeah, so it's just getting that lower back moving. You're using your lower tummy muscles and also your bottom muscles, just trying to increase. So you don't have to do too big a movement. You don't want to push through your legs too much.
Okay.
You're just trying to use around the lower tummy and back, just tilting back and then back into the middle.
Just
Lovely.
like slowly rolling.
Yeah, it feels like a rolling motion. So like you're pushing your back into the bed and then bringing it back to a neutral position.
Okay, excellent. Thanks.
Lovely. Really nice at the end of the day. Sometimes if your lower back is aching, if you've been doing a lot of lifting, a lot of changing, some women really like to do this before bed, but you can do it any time during your day.
It does feel relaxing.
Great. And again, you can do it in this position, or you might want to do it in sitting whilst you're sitting on the sofa or the chair, so you can progress it wherever you are.
So you don't have to be lying on your back.
Exactly, because this probably won't happen that much with a new little one, but you might be sitting down and think, well, I could incorporate that exercise right now, and it makes it possible in your everyday life.
Okay, brilliant.
Okay,
Thank you.
so that's your next one. We'll move on to your third one. So again, we're going to incorporate the first exercise that we practiced. Okay, so let's just try again. So relax, deep breath in, and then gently pull that belly button in towards your spine. Lovely. Now keep breathing in and out. Keep that going, okay? And then we're going to gently bring this leg up to here and then place it back down, okay?
Yeah.
So you can breathe out as you bring your leg up and then breathe in as you bring it back down.
Right.
Lovely. So it's thinking about keeping this working exactly the same level as we then...
thinking about that.
And then we're thinking about the legs.
So when I lift the leg, it's breathing...
Try and breathe out. And then breathe in, relax it back. But you keep those tummy muscles gently working, keep thinking belly button towards. That's it, lovely. You're doing that really well. And then relax the tummy muscles. If, say, you didn't feel that you could control the tummy muscles, you might just want to do 2 and then restart with the tummy muscles again.
Yeah, I think restarting is probably a good thing to do at the beginning while you're getting used to the breathing for your legs.
Absolutely.
If that makes sense.
Yeah, I completely hear what you're saying there.
Yeah, so
completely.
just doing one and then maybe incorporating one leg and then
try
the other
leg.
when you get more used to holding the tummy.
Yeah, because that's exactly, you're trying to combine 2 things.
Yeah.
Which is hard.
Lots.
Lots of things thinking about.
things.
So that's really good. Well done. And then we'll move on to our next one. So we're going to think about those tummy muscles.
Yeah.
So you're excellent at this now. Take a breath in. As you breathe out, gently pull that belly button in. Lovely. Now keep that working as you breathe in and out. And then we're going to keep the legs together.
Yeah.
And we're going to just try and roll them gently from side to side.
Right over.
Right over. But keep this working, okay? So don't let the tummy muscles switch off. So you might want to get back to the middle, reset the tummy muscles, deep breath in, pulling in. That's it, lovely. And then the other way, and then bring them back in. So you get some movement of the back, but you're also challenging your tummy muscles as well.
Yeah, that feels really good. Sort of almost like a stretch throughout the back as well. Is that right?
Lovely. Yeah, absolutely. Really, really nice straight away afterwards.
Yeah, and also sort of down through the backside.
Yeah.
Which can often feel a bit flat after sitting down for quite a long time.
Absolutely. After been feeding and...
Yeah. This is my favourite one.
Good, brilliant. So let's do our last exercise now. Okay, so we're now not thinking about the legs. We're going to start bringing in kind of the head and the upper body a little bit. So, but we always do the tummy muscles. Okay. So let's just restart with those. So nice relaxed breath in. Then as you breathe out, just gently pull the belly button towards your spine. Good, now keep that there. Keep breathing in and out. And then I want you to keep these working as you try and think about lifting your head and your shoulders just gently up, if you can. Lovely. And then back down. Great. Okay. Try it again, but keep thinking. So keep that breathing. Don't hold your breath, otherwise you'll go blue. That's it. So gently think belly button towards spine again.
Yeah.
Good. And then try and gently lift up. Well done. And relax down. Excellent. Okay, so what we're doing there is we're getting the deeper tummy muscles to stabilise our more superficial kind of six-pack muscles.
Okay.
But when we're also trying to start working the six-pack muscles, but without doing anything that's too in high intensity on them.
Okay.
So the idea is that can gently help to bring them back together. Exactly.
Okay.
So if you were to feel any pain in the area when you did that, or you notice a sort of very big doming or bulging of your tummy, you would stop that exercise and you wouldn't carry on. Okay. And you'd want to seek some medical advice about that. But if you can do it as you were doing then, thinking about controlling as you come up, then you're absolutely fine to carry on doing that. But you may not want to do that straight away after having a little one. But now where you are 4 weeks in, you're great to carry on with it.
All right, wonderful.
Okay,
Thank you.
Great.